Managing operations at a research site is hard. Keeping visit windows, communicating with participants, managing stipends, and reconciling financials. Luckily, Real-Time CTMS is here to help. Real-Time CTMS is a leading provider of innovative software solutions for clinical trial research sites, site networks, sponsors, and CROs. Real-time systems allow users to manage complex clinical research processes with powerful, user-friendly interfaces that are revolutionizing how research gets done. To get a free demo, visit the company's website at realtime-ctms.com and complete one of the contact forms. Welcome back to the Note to File podcast, a collection of interviews, best practices, and candid commentary for clinical research sites. I'm your host, Brad Hightower. Today, we welcome back friend of the show, Adam Brown. Adam currently serves as the CEO at ClinArk and is an advisory board member at the Wittenberg Institute for Public Humanities and Sciences. Prior to founding ClinArk, Adam spent his entire career developing clinical trial strategies at some of the largest CROs in the world. He has a passion for increasing clinical trial awareness and access. In this episode, we discuss community engagement, the effects of COVID on clinical trials, and the continued rise of decentralized trials. Without further ado, Adam Brown. All right, back on Adam Brown. Thanks, man. I appreciate you coming back on.
Absolutely. Anytime.
I think you were... If you're listening and you haven't heard Adam's first episode, it's episode 23. So check it out on notefilepodcast.com. Otherwise, tell us a little bit about ClinArk. Remind us a little bit about what you guys do, and go from there.
Yeah, man. So I started ClinArk to really address some of the. Let me back up. I started in feasibility, right? So really assessing trials and figuring out what kind of strategies and stuff we should move forward with. But that kind of inspired me to start ClinArk. And, we started out just like contacting doctors saying, hey, can we, help get you on a trial and all that stuff. And it just spiraled into us doing community engagement and all that. But it really all started from me wanting to change something, really wanting to make an impact and creating, kind of a situation where, we're able to give people opportunity and also kind of bridge the gap out there, bridge the gap for sites, for patients, and just kind of be that point of contact and kind of help, spread that awareness and stuff for clinical trials and other health related information.
So we talked a little bit before, you spent a lot of 2021 out engaging communities and, yes. Kind of just being out there, which, you can't do it if you're not. So I guess tell us a little bit about maybe like some lessons learned or maybe what you found particularly interesting about, being out and engaging people about these sorts of things.
I will say a lot of the times it's as simple as just like asking someone. And I mean that like, it's just people don't know, you know what I mean? So like, if you don't know about something, I think it's going to make you not want to do it or not want to try it. One of the things that we learned is that simply just going in there, asking people, getting people involved, giving people the opportunity to learn about the work that we do, it changes everything. And we've learned that through the work that we've done, just the conversations that we've had and being able to work alongside community members.
Yeah, I mean, I guess it's a fair point is sometimes, people don't know what they don't know. So if you don't even present what it is that, especially, I speak a lot, obviously, from the clinical trial specific side, but it's not well understood even by people in the health field what clinical trials are. So it's crazy to, assume that the general public, and then to go even further, different parts of the public who maybe aren't that trusting of trials and the healthcare system as it is anyway. Mm-hmm. So yeah, I love that you're doing that because I feel like that's something I aspire for as a sort of a site owner, but it's very difficult to sort of get your head up sometimes. We live in a sort of real myopic,
Man. Yeah, it's definitely challenging work. I mean, it's challenging, but it's needed. And I can say this just through hiring people who've never really been, dealt with clinical trials. I mean, seeing their whole demeanor change towards the work after actually doing it, after talking about it. It's a beautiful thing, man. I think it's just giving people that, like I said, giving people that opportunity to just experience it, and to talk about it and stuff. I mean, it really will change a lot and go a long way. I think.
Well, and just having that human face, because, even, if you go look on social media or whatever, I mean, you get spammed with big companies and all the different, messaging they're putting forward. But a lot of times those people aren't engaging you. Even if you ask a question, they don't come back and engage you and talk to you about it. So it's crazy, again, to expect I mean, we ask a lot from people to be in clinical trials. It's not easy.
Yes.
They got to drive across town. They either got to choose between going to work or coming into trials. They
Yes.
got to get somebody to watch their kids. They got to deal with all that. And, it sometimes the process is so kind of, I don't want to say dehumanizing, but it's so clinical, and it's not that level of I guess, yeah,
Care,
exactly.
so
I mean, it's engagement. It truly is
yeah.
engagement. And I guess to sort of piggyback on that, I mean, what are some things that, there's a lot of people like me out, have research sites integrated within physician offices. What would you recommend we can do to better engage the communities in which we work? What are some things you might suggest?
I think just on a high level, just create those opportunities where the community can interact with you and your people, right? So like whether that's you all having just a community event where you all just, serving pizza and talking about what you do, and just a get together for where folks can literally come and learn about what you do. I think that goes a long way. I've seen it go a long way. So, I mean, I think that's a good starting point. And just being prepared to be misunderstood too. And that's just on both ends, like it just happens, but it's a process. It takes patience. I would just recommend that create more of those opportunities for, your staff and, the community to really interact and mingle, so to speak.
Yeah, well, I think you're probably right, especially where, clinical trials has a lot of sort of academic background. And I don't think people always want to have the uncomfortable conversations that might go along with, being misunderstood, like you said, like, because, we still hear it all the time. Like, I don't want to be a guinea pig or whatever the case may be. And not to feel, not personally offended by it, just, it's a fair question that people might have. So, again, I think not just engagement, but honest engagement is sometimes really lacking across what we do, because, we want it to look like we know exactly what we're doing at all times. Nothing bad's ever going to happen. And we obviously know that's not the case with the history of clinical trials,
Yep. Absolutely. Absolutely. Yeah. Definitely the honest part is definitely a big one. People need to feel like you're coming to them with genuine care, and it's just not just about clinical trials, so to speak. So I think that's a big part too. Like, people want to feel like you're genuinely like inquiring about them. And I think that's a big part.
Yeah. I mean, that's fair. It is just being genuine, about it. And, look, we're in our communities. We should care about our communities anyway. So it's just it should just be sort of a happy byproduct if, you get somebody to be in a trial because, just because you're out there, trying to do better for your community and help them out. So again, I think that's, even I feel the guilt sometimes of not being as active or open as I'd like to be, because you get bogged down in the everyday, keeping your doors open and keeping your employees fed, man. That can be challenging.
That's real, man. And I think, I think that it's just a matter of, us navigating COVID too. Like when it's making it hard for us to like also have these interactions too. So that's another thing that's really frustrating because you're like, how do we also have these and do that, but not like spread COVID at the same time.
Right.
Well, it really has. I understand.
Yeah, no, that certainly adds a wrinkle that makes it's hard enough as it is, but then throw that in where everybody's a little bit hesitant to, look, it's not good. You don't want to be getting all your community together and spreading COVID amongst each other.
Yeah. It's a tough one. But yeah, man. Yeah. I think for us, COVID has been something that, like I told you before, I've heard about every week. And as far as community engagement goes, people are constantly worried about it, so it's, it definitely it forces you to get creative, and really think about ways to grow and, navigate it,
That's true. It's going to breed some, maybe more creative solutions, so you got to work around. So, I mean, I guess there's maybe some silver lining there.
I mean, what have you seen on your end from the, on the side end? Like, how has COVID been?
Yeah, I mean, it's a mixed bag. I mean, I feel like at this point we're sort of have this like COVID fatigue, right? People are almost like over it to the point to where it hasn't been as impactful from a, as I would think. Now, I'll be honest, we've had, patients who can't come into screen because they literally tested positive the day before. I've had employees test positive, which, can be challenging as well, but it doesn't look like they're going to necessarily like shut anything down around here. And, I don't know if that has more to do with where I live, in the middle of the country here, where it's pretty politicized to some degree. But, every sponsor is a little bit different on how they treat it, whether they want to come on site or not come on site. And that's part of the problem is there's no consistency in it. It's there are people who I think are afraid to come. They don't want to come into a hospital or a doctor's office unnecessarily, while, there's the risk of it spreading. But I would say compared to when this all kind of started, it's probably less of an impact than it was then, even though things are debatably spreading much quicker than they were.
Right. Man.
I know.
Goodness gracious.
It's been a crazy couple of years, right?
Oh my goodness. Oh man. Well, you know what? At least the viewers will see that, COVID's hitting everyone.
So I know last time we talked a little about like decentralized trials was still a huge buzzword. Yes. You can't read anything without seeing decentralized trials somewhere. I mean, have you seen any noticeable changes over the last 6 to 8 months when we've talked? Like, do you think that they're becoming more embraced or?
Yes.
Think so?
Oh yeah, absolutely. Yeah, absolutely. Without a doubt. It's definitely becoming embraced. And I think that's a byproduct of what we were just talking about, with COVID and stuff. Like, you have to get creative. We have to, like I said, implement things that are going to help people and not, try to make the situation too much worse. But I think decentralized trials are going to be extremely important moving forward. I mean, in terms of community engagement, it's also important, in the whole process. It's one of those pieces where it's like we need to implement that. You know what I mean? So yeah, man, for sure.
I mean, it certainly seems. I mean, I don't know. Look, there's so many vendors competing for attention, but I would certainly think it would help reach people in the community more easily because, like, even COVID aside, you can't be everywhere all at once. You can't necessarily talk to every single person who's out there. But I'm curious to see how some of these methods just broaden the awareness, right, about clinical trials. Or, there's plenty of people, even our community here, they don't know that we're here. They don't know that the options exist to them. So I'm curious to see how that can be leveraged because, I'm sure it feels like awareness is like more than half the battle, right? Just the existence of what clinical trials and what they are.
Yeah, I think awareness is definitely, if I'm hearing you correct, awareness is definitely half the battle. Like I said before, it can sometimes be as simple as just talking to someone about it and them learning more, getting those questions out that they've been wanting to ask someone, because maybe they had that question that was just like, depending on how they answer this, it's going to, so it's just, you never really know, man. I think, it's just really about just talking to folks, man. just talking it out, and see where folks are at, and then maybe able to, whatever information you may have, maybe able to change their outlook, on the situation.
Sure. Are your guys' like clients, I guess, are they more on the sponsor CRO side, or you work directly with sites, or sort of how does that work for you guys?
So we actually work with the sponsor and sites, but the way it works is in terms of sites is different. We're trying to kind of be that glue, right? When we're working with sites to try and help, streamline things on the ground and be kind of the extra, arms out there for the sites to, get things done that they need help with. Now on the sponsor side, we're helping them develop their strategies and stuff and really get some of the information from the community that they may not be receiving, otherwise, so they're able to use that information, something tangible that they can then move forward with and say, hey, maybe we should think about doing this or whatever they, decide to do with that information. You know what I mean? But just try to help them just to shape trials that are really thinking about the community.
Do you see a lot more interest over the last 6 months with sponsors wanting to work with groups like you guys? Or do you think it's that idea is picking up some popularity, really baking in the idea from the beginning of the protocol development rather than sort of after the fact to be like, oh, oops, we didn't message very well, or we didn't include a certain group or whatever the case may be.
Right. Yeah, absolutely, man. I think the sponsors are definitely seeing the importance of it now, at least from my experience, and after having, worked on several projects, I it's safe to say, that they do see it, they see the importance in it. I think the challenge is making sure that, at least on our end, is making sure that we're delivering the information in a way that is digestible for our clients and stuff. But I mean, for the most part, it's definitely something that they value.
Yeah, I can see that. And again, I'm interested, from the site side, like as far as sites reaching out and how they might be able to work with you. What does that kind of look like? So
we actually just got an email today. But I mean, for the sites, it's a matter of just like signing up on our end. And we're reaching out to you, as opportunities present itself on our end, and we're just kind of spreading the love, just to make sure that, because like I said before, I think I said it on the first interview that we did, through my work, I recognize that there was kind of this over, I guess, concentration on, a few research centers, so it's just like we're just constantly going to the same site over and over again. And, I'm trying to figure out a way where we can kind of disperse that a little bit so that, folks are getting considered that may not, otherwise be considered. So that's really kind of what our model is built around, trying to get sites opportunities. So, I mean, it's just a matter of contacting our team, and our community engagement manager or whoever answers the message will, we'll take it from there. But yeah, we're trying to really spread the love and get the community involved in sites and all that.
And that's something I saw a conversation about recently, is how hard it is for new investigators, or who don't have a lot of experience to get involved, which, it's so weird to me because it seems obvious, right? Like there's a lot of investigators or wannabe new investigators. We're talking about patient populations who are either underserved, just not served at all, maybe ever. And, the studies want new patients. So where's the hesitancy, or why the hesitancy in, vetting new sites or bringing on new investigators? I mean, do you feel like that's something that's likely to, shift a little bit?
I think it's shifting, but I think it's a slow process. Just because, I mean, I understand both sides. I understand where the hesitancy comes from, but also understand the site side. It's like, hey man, let me, I want a shot. Like, so I understand it,
Right.
But I think that it has to change, really. I mean, or we're just going to be sitting here with the same fragmented, issue. We have to change it. We have to consider folks and give people the opportunity to get experience under their belt. Because, I mean, I've had sites reach out and, the hang up for them was like, hey man, like I don't know what to do with this budget. Like, what are we supposed to do? Stuff like that, and it's those things that like will literally stop them from being able to participate. And it's sad because they probably have like access to like the, the people that would need that particular trial or whatever that's happening. So it's, yeah.
Yeah. I mean, and that's, that's something when I started my business, and there's a lot of people like me doing what I do. There's a almost like unnecessary barrier to participating in research, and through things like that, like how do I negotiate a budget? Some people don't even know to negotiate a budget. How do you submit to the IRB? How do you, put together the regulatory documents? And that requires an almost like super specialized skill or, it's hard to find. So it is kind of crazy that, look, those things aren't necessarily rocket science. Don't get me wrong. They're not the hardest thing in the world, but if you don't know what you're doing, it can be very difficult to navigate those things. So there's already like a built-in thing keeping a lot of people out just by virtue of not knowing. And there's not a lot of resources out there that
Right.
you can easily digest how to do it. Yeah, that's a good point. I think that's I guess I'm curious to see if one of two things needs to happen. Either we need to open up more research to the community, away from the big mega site and out into the community, or I guess they could do less sites and just use more DCT, methodology, and then you really don't need more sites in the community at that point. So that's what's interesting, is which way does it sort of consolidate?
I I don't think it's a good idea to just rule this. Like the sites have to be there. The sites are very important. So I don't think that we should ever think about decreasing them. But I definitely think that the decentralized space is going to give us the ability to just reach more people in those kind of corners that we can't reach, so to speak. I think of it as looking at a map, and you're seeing folks that are maybe we can't get to that group, but we can get some technology up there to help them. So I just think that technology is going to help us, right? It's going to help us kind of close some of these gaps, but we still need the site, right? We still need a person still needs to be able to put on their shoes and drive over and talk to the doctor and have those conversations that they may not want to have,
right? Yeah,
online or whatever. So it's definitely a balancing act, but I think that they're both equally important. I think we have to find the balance.
Well, I think that's it. I think there's some hybrid of the two ideas, because I mean, I could I sometimes get the impression that DCT is really more centralized, if anything. I mean, you could have less sites, more centralized, because you can be reaching more people across a bigger geographic area. So you're actually centralizing more of the things across less sites, possibly. But again, I don't think that's the winning formula by any stretch of the imagination. But I sometimes worry when you see some of the lofty goals of some of these DCT vendors who maybe don't consider that. Which I'm with you. I think you've got to have that human touch.
It's all about I think it's all about the balance, for sure, man. Because it's again, you don't want to just feel like we're just hovering. It's just I can't go talk to someone about this. Right. So I think we don't want to get to that point. I already get annoyed when I'm I'm calling one of these phone companies and I have to talk to the robot. It's come on, man. So it's kind of that feeling. It's I don't want it to feel like that. And I think that's what we should not let happen, right? We still need to, maybe that technology leads to them having to call a doctor ultimately, but we need to find that balance, and just, I think just keep, moving forward, but just not letting one
right. Don't exchange one problem for another,
Right.
We'll see. So what's we're here in the early part, 2022. What's on the schedule for ClinArk? What kind of things are you guys looking forward to in 2022?
Man, we're going to be focusing a lot on mental health, and in the rare disease space, but we're also going to be doing some, I mentioned to you, I want to start, I think I told you, I want to start creating our own, kind of, tech and stuff like that. So software and stuff like that. Just because I mean, there's no better time to start doing stuff like that, so, why not, and really, it's just another opportunity to learn, and provide something to the community. But, I would love, those three things are going to be important to us this year, developing kind of, that software, and then, rare disease and mental health. Those are going to be the spots for us.
Nice. Yeah. No, I think you're right. There's no better time right now. There's such a just crazy increase in tech, in clinical trials. Mm-hmm. There's a lot of money getting thrown around. So there's certainly some opportunities out there for investment, especially, you're out there doing the damn thing. And a lot of these people are coming in from the outside without really any knowledge of clinical trials. So I think that's That's a key right there. Someone who understands the sort of landscape of how these things work. So I love that, man.
No, thank you. And one of the things that I've noticed is that it also changes how you code things, right? So like by knowing what it feels like to, be out there doing these things, like I'm looking at how we're creating these things differently, because we've physically experienced it, so it's a nice balance. And I'm really looking forward to cranking out some cool stuff.
Yeah, we'll be on the lookout for it. That's for sure. I love it. All right, man. Anything else? Anything else you want to talk about?
Man, I don't have anything, man. I'm just excited to be back at it, man. It's definitely nice.
Cool. Yeah, I just wanted an opportunity to catch up. I've been, kind of keeping an eye on you on LinkedIn and see that you've been staying busy. I love that, and I think you're one of the great voices here in what we do in clinical trials. So, I mean, I appreciate you and what you do. And where can people find you? Where can people find you to connect with you online?
Hey, man, just, find me on LinkedIn, Facebook, if you really want to get personal, I guess. I don't know. But no, you can find me on LinkedIn, Instagram, the kind of standard, Twitter. You just type in Adam Brown Sr. and you'll find me. But I appreciate it. And, thank you so much.
All right, man. I'll have your contact info on our show notes. And as always, Dan, it's good to talk to you. Thanks for coming on.
Thank you. Thank you.
As always, thanks so much for listening. For episode transcripts, contact information, and show notes, please visit us at notetofilepodcast.com. Thank you.